Hi, this is Deborah Bean with Mount Pleasant Ski Patrol in the Rocky Mountain Division of National Ski Patrol. Today we'll be talking about, why is Jack Burns' name on here? Anyway, we'll be talking about cardiovascular diseases. Okay, in chapter 15. This session will be long because it's complex and particularly important for a first responder. Review the anatomy and physiology of the cardiovascular system as described on pages 459 through 463 of your textbook to become more familiar. The common causes of cardiovascular disease is one of the topics we'll be discussing. We'll be talking about the types of cardiovascular emergencies that we might see, and later on assessment and management. Okay, our case presentation is that you're called to a remote trail location where a 42-year-old man complains of chest pain and appears to be in considerable distress. He was snowshoeing with his family when he felt sudden crushing pain in his chest that radiated down his left arm. He is pale, sweating, feeling nauseous, and is weak. He has had a history of heart problems, but never this bad. Already you're going to be thinking about who you're going to call, what resources you're going to ask for, and how you're going to begin and continue with your assessment. The common causes of cardiovascular emergencies are atherosclerosis, hypertension, congestive heart failure, pulmonary edema, angina pectoris, myocardial infarction, and cardiac arrhythmias. According to the World Health Organization, cardiovascular diseases, or CVDs, are the #1 cause of death globally. More people die annually from CVDs than from any other cause. An estimated 17.7 million people died from CVDs in 2015, representing 31% of all global deaths. Of these deaths, an estimated 7.4 million were due to coronary heart disease, and 6.7 million were due to stroke. CVD is the #1 cause of mortality in the U.S. for both men and women. About 1 death in 4 is from a cardiovascular disease. We'll continue with other causes of cardiovascular emergencies that you might see. Of course, we're familiar with a sudden cardiac arrest. There could be a thromboembolism, pericarditis, and pericardial tamponade, an aortic aneurysm or an aortic dissection, heart valve disorders, and they could have concurrent cardiovascular diseases. Why is this doing this? I apologize. Okay, we'll just talk about atherosclerosis to get it started. This illustration is the same as figure 15.8 on page 464 of your textbook. You'll notice that this deposit of cholesterol and lipids or fats goes on for a lifetime. As time goes on, more fatty deposits develop, leading to a fibrous plaque. Blood platelets adhere to these deposits, continuing to reduce the amount of blood that can flow through the artery. That means that the heart becomes damaged and can lead to death. Atherosclerosis is known as hardening of the arteries. The patient's risk factors and other factors cause the inner wall to be damaged, and the fatty deposits develop and lead to those fibrous plaques. All this builds up over time to completely block the artery, as illustrated in letter D. The heart doesn't receive the oxygen and nutrient it needs, and the heart muscle dies. This type of cardiovascular disease leads to hypertension, or high blood pressure, heart failure, acute myocardial infarction, or an AMI, and sudden cardiac death. Hypertension or high blood pressure is often a silent and symptomless condition that the OEC technician must be carefully observant to see. The exertion of outdoor activity brings on signs and symptoms where the patient might be anxious and uncertain because they probably don't know that there's anything wrong. Early treatment and managing controllable risk factors are key to successful prevention of more serious CVD problems. Untreated hypertension predisposes patient to cardiovascular disease because of damage it causes to blood vessels over time. Some of the factors that can raise the risk of having essential hypertension include obesity, diabetes, stress, lack of physical activity, too much salt intake or not enough potassium intake, and chronic alcohol consumption. It can result from an undiagnosed medical condition such as kidney disease and is more common in people over 65. People of African descent are at a higher risk as well. Congestive heart failure is unilateral heart failure. Because the heart is basically two pumps, the right side and the left side, in one, either side can fail independently or with the other. Left-sided heart failure is when the left ventricle can't pump out enough blood to the body. It gets backed up in the lungs behind the left ventricle, causing pulmonary edema, a buildup of fluid in the lungs. Among other things, this brings about shortness of breath. Left-sided heart failure often leads to right-sided heart failure. Right-sided heart failure involves the right ventricle when it cannot pump out enough blood to the lungs, causing fluid to back up in the veins and then in the capillaries of the body. Because of the backup, fluid leaks out of the capillaries and builds up in the tissues, a condition called systemic edema. Edema is especially noticeable in the legs because the lower half of the body drains into the right side of the heart. Pulmonary edema is the accumulation of fluid in the lungs. People who have congestive heart failure often have pulmonary edema or fluid accumulating in the alveoli in the lungs. It typically happens when the left side of the heart has been damaged. The inability of the heart to pump blood out to the body results in pressure buildup and accumulation of fluid in the alveoli. People often have right-sided heart failure as well. Since the right side of the heart receives blood from the body, it backs up into the body. Usually this is seen as fluid accumulating in the lower body. This person will have trouble breathing and may be sweaty, pale, and anxious. They will have trouble laying down and breathing. Not all pulmonary edema is from heart disease, but can be seen when people are exposed to low atmospheric pressure in high altitude, which is something we'll talk about at another time. This is an illustration of angina pectoris. Notice where the coronary arteries are and that there is a partial block producing chest pain. Just below that, you see an illustration of how the area has a decreased blood supply, and so we can assume that this part of the heart will die. It occurs when the angina can result in an area of the myocardium becoming ischemic or not having enough adequate oxygen. And you can see in the illustration how a part of the heart doesn't have enough oxygen. The person will have chest pain or discomfort caused by lack of blood supply to the heart muscle, and if this happens over a period of time, infarction may result. It's important for the OEC tech to monitor this patient carefully to see that the condition improves. With angina pectoris, stressors such as physical activity and certain drugs can also be associated. When the stressor is eliminated, pain also usually subsides. This illustration of a myocardial infarct is a cross-section of an MI. You can see in the illustration that some of the heart is damaged due to not having oxygen to that area. The MI can cause enough coronary tissue damage that a host of other life-threatening problems can occur as a result, including cardiac arrhythmias, congestive heart failure, cardiogenic shock, and sudden cardiac death. The importance of immediate emergent care cannot be overemphasized in this situation. Cardiac arrhythmias are the irregular heartbeat or heart rhythm. While many are benign, life-threatening arrhythmia is caused by an ischemia of the heart muscle, not getting enough oxygen and nutrients. What are the effects? Bradycardia, or slow beating heart, tachycardia, or rapid beating, or altered regulation of the rhythm. This can lead to shock or cause blood to pool and clot inside of the heart. I'm going to go back to cardiac arrhythmias. Consider that bradycardia is less than 60 beats per minute and tachycardia is 100 beats per minute. Ventricular fibrillation and ventricular tachycardia are two life-threatening arrhythmias that can lead to sudden cardiac arrest. This happens when there is a sudden stopping of electrical activity in the heart, so that the blood cannot be pumped to the vital organs like the brain. Sudden cardiac arrest usually causes death if it's not treated within minutes. The two other types of sudden cardiac arrest of the electrical problems in the heart are VFib, or ventricular fibrillation, and ventricular tachycardia, or VTAC. Both of these are shockable rhythms with an AED. Ventricular tach occurs when the lower chamber of the heart beats too fast to pump well and the body doesn't receive enough oxygenated blood. Most patients who have VTAC have a heart rate that is 170 beats per minute or more, plus the ventricles beat out of sync with the atria. VFib is when the heart quivers instead of pumping due to disorganized electrical activity in the ventricles. VFib results in cardiac arrest with loss of consciousness and no pulse, and is the leading cause of sudden cardiac death in the U.S. Asystole is when there is no electrical activity and it cannot be shocked back into existence. A thromboembolism is a blood clot or fat or other solid material that is blocking blood flow in the venous system. An embolus is a thrombus that breaks loose and is carried in the bloodstream until it lodges in another site in the body. Depending on its size, it can go undetected for months or years until it disrupts blood flow. A DVT, a more familiar type of thrombus, occurs when blood clots form within one of the large veins of the extremities, commonly the lower extremities or pelvis. It is usually caused by prolonged periods of sitting, inactivity, or immobilization. That's why when you're on an airplane, you need to move around. Pericarditis and pericardial tamponade are two other conditions. Pericarditis symptoms can vary with position and last for hours or days. Inflammation can cause severe pain, especially on deep inhalation or when coughing. The cause is usually viral, and treatment involves pain relievers and anti-inflammatory medications. Pericardial tamponade is when there is excess fluid in the sac around the heart, causing pressure on the heart and preventing it from adequately filling with blood, restricting its ability to circulate blood. It's life-threatening and requires immediate emergency care. Check out the figure on, it's called 15-14 on page 469 of your textbook. An aortic aneurysm. The aorta is the largest artery in the body, starting at the left ventricle and branching down the body to the abdominal aorta. They are most commonly located in the abdominal aorta, but can also be located in a thoracic aorta. Aneurysm can also occur in the brain. Aortic aneurysm is a ballooning outwards of the aorta. An aortic aneurysm will form a bulge or balloon that can give way, causing an aortic rupture. Most people do not survive a rupture. An aortic dissection is similarly fatal for many people. The aorta has 3 layers so that it can withstand the pressure of blood rushing through it. And an aortic dissection is a very serious condition in which the inner layer of the aorta tears. Blood surges through the tear, causing the inner and middle layers of the aorta to separate or dissect. It is often symptomless, but is usually fatal if the aorta ruptures. There is a valve through which blood passes before leaving each chamber of the heart. The valves prevent the backward flow of blood. The heart valves can malfunction either by leaking, causing regurgitation, or by not opening adequately and thus partially blocking the flow of blood through the valve, causing stenosis. Stenosis and regurgitation can affect any of the heart valves. This disorder is usually congenital, but can be the result of an MI, heart disease, an infection, or trauma. As the slide says, cardiovascular diseases often occur in combination with one another. It's critical that any suspected cardiovascular disorder must be considered serious until evaluated by a physician. Now let's go back to our case update. After ensuring that the scene is safe, you summon ALS, Advanced Life Support, and begin your assessment. You notice a pulse of 128 beats per minute, respirations of 28 respirations per minute that are shallow, and blood pressure is 164/94. The physical exam reveals an overweight man who is short of breath and appears to be very anxious. He is diaphoretic. He describes the pain as 9 of 10. You discover he has a history of angina pectoris, but this is the worst it's ever felt. I feel like I'm going to die. Okay, what are the scene safety issues and what actions can you take? What do his ABCs and vitals tell you? What do you find in the physical exam? What does his emotional condition tell you? I would say that he is in a very serious situation. This may be worse than an angina attack. And what requests do you make for assistance or supplies? This is the end of part 1 for cardiovascular disease. We'll go on to part 2, which describes assessments.